with you. Perfect. Wonderful. So feel free to put your introductions in the chat. I'm Sarah Davidson. I'm the head of psychosocial and mental health at the British Red Cross, and I'm also one of the co-chairs for the movement's MHPSS research network, alongside Monia, who hopefully will also introduce herself. Go, Monia.
Yes, hi everyone. My name is Monia Ebersol. I'm the MHPSS International Focal Point at the Swiss Red Cross, where I'm also in charge of the development and implementation of different low-threshold psychosocial and psychological interventions. I've been co-leading a working group with Sarah Kate van der Walt as part of the MHPSS roadmap, trying to strengthen the evidence around MHPSS interventions through research, evidence monitoring and evaluation. And I'm happy to be officially part of this MHPSS research network now as a co-lead. Happy to be here. Welcome to everyone.
Thank you, Monia, and we warmly welcome you as a co-lead. And ordinarily, I would then be handing to someone from the Federation Psychosocial Reference Centre, since they are also co-leads, but the person who is holding that isn't here today. So we just have two co-leads, Monia and I. Hope that that is sufficient for your purposes. Let me just tell you a little bit about the research network. So it was actually established in June 2016 with the idea to provide effective humanitarian action through a strengthened evidence base across the Red Cross and Red Crescent movement for mental health and psychosocial support for beneficiaries, volunteers and staff. It's a space for collaboration and shared learning that brings together both researchers and practitioners who are affiliated with the movement and those from further afield. It's hosted by the Federation's Reference Centre for Psychosocial Support and co-led by the British and Swiss Red Cross. And we basically, over the period of each year, release usually quarterly newsletters highlighting important developments in global mental health research, events and funding opportunities. We host webinars like this one that showcase best practice and highlight lessons learned by those conducting research and evaluating programs. And we organise meetings where researchers and practitioners can meet and share best practice and build relationships. The research network is seeking to connect with more national societies. And so if you or other people are interested, or indeed other kind of practitioners and researchers in mental health psychosocial support, please get in touch. Monia will put the details of how you can find out more about the research network in the chat. In fact, Monia is going to put more links in the chat as we go through. So please keep an eye. Just to say, over the next 55 minutes, basically we're going to present a little bit more about climate change and mental health. I shall introduce our authors of some research and the presenters shortly, and there will be a space to ask questions at the end. So if you have comments or questions, please feel free to use the chat, and then at the end, please put up your hand and I will ask you to speak. But otherwise, thank you for keeping on mute in the meantime. That's helpful. So just to think about mental health and climate change, the climate crisis is, of course, a humanitarian crisis. Climate change is already contributing to humanitarian crises, and climate and weather extremes are increasingly driving displacement in every region of the world. And the climate crisis is increasingly creating health risks for populations worldwide too. The direct and indirect impacts on mental health and well-being are concerning and often neglected. The International Federation of Red Cross and Red Crescent Societies, that's the IFRC, their reference centre for psychosocial support. So the Psychosocial Centre, their mission is to promote and enable mental health and psychosocial well-being at a global level. In 2023, this centre initiated a consultation process with the aim to better understand the intersection between mental health and psychosocial support and climate change work in the work of national societies. And 15 national society representatives participated in their project. Today, the authors of the report are here with us to present the high-level overview of the climate-related mental health risks as identified by the consulted national societies, and to discuss potential pathways to addressing the mental health and psychosocial challenges arising from the climate crisis. First speaking will be Shona Witten, who is a technical advisor in mental health and psychosocial support at the Psychosocial Centre, specialising in mental health and psychosocial support in emergencies, climate change and protection, gender and inclusion. Prior to joining the Federation, Shona worked in emergency operations with the Australian Red Cross for over 10 years, most recently as National Lead for Recovery and Psychosocial Support, responsible for the coordination and development of the Australian Red Cross's field disaster recovery operations and emergency mental health and psychosocial programmes. Finia Digley is a consultant at the Federation's Psychosocial Reference Centre with a focus on the complex psychosocial impact of the climate crisis on mental health and well-being. Prior to joining the Federation, Finia worked for the WHO Europe on initiatives in digital health and for the Euro Health Group with a focus on monitoring and evaluation. She's currently completing her Masters in Global Health. Thank you both. I pass to Shona.
Thank you. I was distracted by responding to Basilio's comment. Hi, Basilio, and it's nice to see some familiar names and faces on the screen here. So it's really nice to be with you all this afternoon, or in the morning if it is for you. But yes, so yes, thank you for that introduction, Sarah. I was just commenting to Finia while I was here. It's always awkward listening to people talk about you when they introduce you. So yes, we are going to talk a little bit about this project that we undertook the second half of last year into this year, and then I will pass to Finia as well. So I'm going to start with a bit of the background and the reason why we undertook this piece of work. So when I started at the PS Centre in late 2022, yes, thanks, yeah, I was given the climate portfolio, I suppose, and it was a relatively new portfolio for technical advisors in the PS Centre. Many of you will know Ia, who prior to me joining had done a number of things with the Climate Centre. But by and large, I think a lot of the work we had done on climate prior to last year was sort of reactive. People had come to the PS Centre and asked, asked us for our thoughts or to be involved in particular activities, and much of that was with the Climate Centre. And so I suppose coming from Australia, where I had just managed recovery operations after a number of disasters that, or certainly I felt were climate change was a significant contributing factor. And since then, there's certainly been evidence from scientists to support that. I felt that this was something that we really needed to do more and look more at, this intersection between the climate crisis and mental health and psychosocial support, and that the PS Centre certainly had a sort of a place here to look at how we could support national societies to grow their work related to the climate crisis. However, also coming from a national society for a long time, my question was, what's out there already? What are national societies doing? What do they want to know in relation to the climate crisis and MHPSS? What are they currently doing? What are the challenges that they are having in this work? And what would be useful for the PS Centre to do related to climate and mental health? So I think I had more questions than I had answers at that point. I continue to feel the same way, to be honest, with this, which is, I think, important to be the research and monitoring and evaluation also part of this work is critically important, as in all of ours. But I think as we will discuss, I think there's such an evolving field for us at the moment that we have to stay engaged with research and be involved in research related to the kind of intersection between climate and mental health. So one of the things, having had that kind of perspective of what is it that's useful, what might be useful, what is it that is kind of happening, I felt that a short, small kind of consultation piece would be a really useful piece of work to undertake. And I think serendipity kind of came to be involved at that point, because Vinya reached out to the PS Centre and was interested to do an internship as part of her master's. She was initially interested in emergencies and disasters, and I said, what about climate change? How would you feel about doing some work on climate change? Because she, to her credit, had a strong interest in doing something that was impactful for the PS Centre and for national societies. So was gracious in letting me brainwash her slightly, which was great. And so we then sort of set about designing this piece of work, which was really centered around looking at what we had already, which, to be frank, was not a lot, to be honest. So there had been in, I think, 2021 or 2022, actually, a fact sheet co-developed by the Netherlands Red Cross, the Red Cross Climate Centre and the PS Centre on climate change and mental health. It was, I think, about 8 pages or 8 or 10 pages or so, and didn't necessarily have a focus on what national societies were doing, but really provided a point in time. This is what we know. It had a strong focus on heat and the impacts of heat waves, and some great, a very useful piece of work, but felt for us a little bit, things had moved on a little bit. There wasn't a very big focus in that paper on social impacts, on the kind of complicated drivers of challenges to people's mental health and well-being as a result of the climate crisis. So we wanted to look a little bit more at kind of updating information. We felt that potentially a second evolution of that might be useful, but also what we really wanted to hear from was voices from national societies. So we decided to do some desk-based research of kind of new information that was coming out, as well as do semi-structured interviews with national societies. So I might hand over to Finya, because as I said, she did the bulk of the work in preparing this report. So you may have seen it. I know that a number of national societies have used it already, and we're really pleased that it's been impactful for people. I've certainly heard of people outside the movement also using it. So I think for us, it really tells us that it was a useful piece of work, which is great. But yeah, so I will give the mic to Finya to kind of tell you a little bit about who we spoke to, what the challenges were. We're also mindful that this is about the research, right? The research process, this webinar. So we will touch on obviously the outcomes, but also we want to just share a little bit about some of the challenges we had in preparing this piece of work, or doing the research and preparing the report. So yeah, Finya.
Perfect. Thank you. Yes, so as Joanna was mentioning, I'm currently doing my master's in global health, and I was interested in working with emergencies because I had done a minor in disaster risk management, but I was quite new to the field of climate change and health. So when we started this process, I kind of started also with a literature review, looking at kind of the state of research as it is now, which we then later used as kind of like the basis of the work as well, looking at papers from around the world that were looking at the different mental health aspects related to climate change. But the key point being very much the consultation with the national societies, because we really wanted this to be grounded in the needs that were voiced by national societies and the work they were already doing. So the purpose was already mentioned, looking at both the work I was doing and gaps as well as opportunities. One of the main challenges of this process, which often of course is the case in research, was the limited time and some of recruitment difficulties, because I did most of the interviews starting like in November, December. So Christmas period was coming up, everyone was going on holiday, so it was a bit difficult to get in touch with everyone. But luckily we managed to still interview 15 representatives of national societies, who were all kind of sharing how they had been impacted by climate change, so their country and region, as well as the communities that they work with, and then talking about some of the challenges they had faced when trying to address some of these mental health needs in the context of climate change, and also challenges with kind of integrating mental health care or MHPSS into climate work and emergency response work.
If I could add, I think another challenge we had with recruitment was around some people at national societies who weren't yet working in climate, thought that we weren't interested in talking to them because they weren't yet doing climate change related work. Yet that was also a really interesting thing to discuss with some national societies, because we wanted to try and get an understanding of barriers within national societies to more work, more MHPSS kind of integration into climate work. And I think the same for national societies who do have climate work, but it wasn't MHPSS focused. So I think for people doing research on this topic in the future, whether it be within national societies or in their own organizations or within academic settings, that was a real challenge for us. You know, we were looking at this intersection, but sometimes it meant that people would kind of like self-select out of our little research project because they didn't think, oh, well, I'm not an MHPSS person, or we're not doing climate change. Whereas I think it's so, there's so many factors that contribute to, or climate change is so cross-cutting is probably a better way to say it, that we could have maybe crafted our recruitment a little bit better to be able to communicate to people that we were really open to a broad type of participant. We weren't just looking for MHPSS focal points, for example. So I think that's also a big challenge that we had.
Definitely. And I think that was what was good in a way was that with a lot of the national societies that I was in contact with but didn't end up speaking to, there was a clear interest in the report, exactly because of what Shauna just mentioned, that they were not necessarily currently addressing mental health needs in relation to climate change, but that was often related to maybe them not really knowing how to take those steps, as well as maybe to some extent like a lack of understanding how mental health and climate change are correlated and the different implications it can have. And there often being a bit of a focus on the top of the pyramid, so looking at more the clinical outcomes related to climate change and not necessarily at the more psychosocial well-being aspects. So when I was interviewing these different members of national societies, often the conversations also started by them saying, we're not really addressing mental health needs. But then while we were talking about a lot of different projects that we're doing with emergency preparedness and response and climate risk mitigation, it was quite clear that they were actually addressing a lot of mental health needs, but not necessarily directly. So that would have also maybe been a good thing to consider in recruitment, to maybe frame it in a different way, so it was clearer what we meant by kind of mental health work and MHPSS, but still was very insightful to talk to the different national societies, and there was a very strong interest, and the need became quite clear. And we'll talk about this later as well, that it was more of a first step as well for more work to come to really address the needs that were mentioned by the national societies. But yeah, so we talked about both climate change impacts that they'd experienced, but also about implications for staff and volunteers. So they were talking to me about how they themselves felt impacted by climate change, but also what they'd seen among their colleagues with their staff and the volunteers, how they'd been impacted either directly or how they had been or felt implicated by working with affected communities. Because of course, individuals might not themselves be impacted by an extreme weather event, but then if you're responsible to supporting communities who have been severely impacted, that will also impact you. And then talking about this importance of caring for staff and volunteers. And then lastly, we talked about existing initiatives, which also kind of informed the later part of the report, which we're going to talk about shortly, as well as some of the gaps and opportunities. Yes. So so we in the report then started with more of an introduction to how climate change can impact mental health and well-being. They're looking both at like the direct impacts as well as the more indirect exposure, the anticipated and vicarious exposures to climate change. because often individuals might not yet be directly exposed to severe weather events, but you can still experience severe climate emotions because you can see via social media or by talking to family members who are already impacted, you can see the severe impacts that climate change is having, both by the more immediate severe weather events, but also by the slow onset impacts such as rising sea levels and rising temperatures and so on. And that can also have quite strong mental health implications and triggering anxieties and fears in terms of the future. And then we structure the report a little bit by looking at how different population groups or communities are impacted differently and some specific mental health risks they were having. So you can see on the slides some of the different groups that we were looking at. What was important here was for us to also frame that while there are some vulnerabilities, it's important to also not just look at affected communities as helpless, but really see that their insights and knowledge and local expertise is really valuable and important when coming up with solutions on how to address their mental health need, and especially with preparedness work, and that they really have the inside knowledge of how what kind of support they need, because they are already forced to address the risks that they're facing. So when coming in to try to implement climate change actions or MHPSS works, it's really essential to speak to them and consult them in finding the solutions. Which again was also why we wanted to really consult the national societies when writing this report, because they are the ones actually doing the field work and working with the communities who are impacted already.
And if I would add, the structure of the kind of literature review section of the report was driven a lot by also what came out in terms of areas of interest or areas of concern, I suppose, from participants who Finya spoke to. So we felt it was obviously important to include like a high level overview at the beginning around what are the you know, the exposure pathways, I suppose you could say. I mean, that's some of the language that's used in the WHO policy brief that I think, Gracie, you have shared, but also is linked on our website that I know Monia will share the link to in the chat. But sort of these, like, what are the kind of ways that climate is going to impact our mental health and well-being? So we wanted to kind of look at, as Finya said, these kind of cumulative changes, extreme weather events, anticipated vicarious exposures. But that was really important, we felt, to kind of almost provide a summary for people using the report to kind of have a bit of an understanding, okay, what's the problem here? And then these kind of almost like they read a little bit like target audiences, but these were really things that came out from the participants. We're concerned about how to support children and young adults. We're concerned about older adults in our communities, people with disabilities and chronic health conditions, and also people who are experiencing homelessness. So that was kind of, I mean, obviously there are other target groups, but really, and then these other two more cross-cutting themes around climate mobility and conflict. These were both issues that come out in the research, but also were highly important kind of topics that came up across all of the interviews. So while this was more of a summary of the research that exists and not, I suppose, direct outcomes from our report or our consultation, they were themes that came up as areas of concern that national societies are looking to understand how to address in the future.
No, exactly. And that was very much mentioned throughout all the interviews as well, that often with the people that I talked to, they either had like an emergency background or mental health background, and they were also very much aware, of course, of the mental health impacts, but they were voicing that there's really a need of kind of a document that was explaining the correlation or the impact that climate change can have, to also use as kind of an argumentation for implementing more research or implementing more projects that are actually addressing those needs, and for potentially funding for these projects as well. But yes, so these different subject areas were very much focused on what they were sharing with us. And then, lastly, we're also giving some examples of projects that were already implemented by national societies. And here it was very much also focused that one might not directly see as like a mental health initiative, but that were then indirectly also benefiting mental health because they were addressing determinants of mental health. So, for example, there was a gardening project where a community that was quite impacted by heat waves was working on planting more resilient produce, which then led to reducing their food insecurity, which of course then led to a reduced mental health burden, this fear of not being able to feed your family and having a reduced income. So there are many different ways that mental health can also benefit from a variety of different projects that might not necessarily be specifically targeting mental health needs, just because it's all so strongly interconnected, just as it is with physical health as well. Yes.
Go to the next one. For you?
Exactly.
Oh,
yes.
Oh, yes.
So
maybe we could just, sorry if I just interrupt. I think from the consultation, the kind of 3 themes. So obviously we spoke about those important aspects, but there were 3 things that kind of national societies wanted from the PS Centre, which I think is important to feedback, and 3 main themes about things that they were concerned about. So one was talking to their colleagues and volunteers about climate change and mental health. So how do we describe the urgency? How do we talk about integrating MHPSS aspects into climate programming or disaster risk reduction or related or health in relation to these risks that climate is posing to us, or changes in climate is posing to us. So that was a big one. The other was, as Finia mentioned, a really strong concern about the health and well-being of staff and volunteers. And the final one was about programming. So what is it that we can do in a programming sense related to MHPSS and climate change? And so these are some things that we are taking forward, and to think about how we can address some of these in additional resources and materials from the PS Centre. Those are unpacked a little bit more in the report, but I think is important. These weren't surprising to me at all. I think the one about talking about climate change, it makes a lot of sense. Something that I've heard a lot, not just through the consultation, but also from people from other organizations, is that it's so complicated. And as Finia has said, there's so many aspects of changes in climate, of more extreme weather events, of fear for the future that contribute to reduced well-being and impacts to people's mental well-being, that it's really difficult to know where to start for people. And there is this, maybe we need new things, maybe we need to start from scratch. So, or how do we help people? Where do we start, So that was really, that's prevalent to me from not just this work, but others, and is something that I think the report made some baby steps towards giving people a resource that they can use, that's kind of simple, that's digested some of the existing research out there, but that has also, that's specific in some ways to national societies as well, in terms of what it is that they're looking for. So I know what Finia is going to talk about now, so maybe I'll just do a little intro for you. So as part of the work that Finia did for the PS Centre, I think raised a lot of questions for you, particularly around experiences for young people, because that was also quite a big theme that came out of the consultation that we did. And she had this pending thesis kind of hanging over her head, potential project. And so we talked a lot about what that could be, whether or not we would take some of the findings of the report further, whether or not she would do something completely different and take a break from climate, but I think has landed in a really interesting place. And I think for people doing research around climate and mental health, I think one of the really interesting things from our little experience here is that one thing led to another so easily.
Yeah.
And I think, which is true for research, I think in other sectors, but also for us, the consultation we did, and a very small consultation, right, 15 participants, has really given us more questions than it gave us answers, to be honest. But it's been great that Finya's been able to explore this topic around young people and their experiences a little bit more in a very particular context. So I think she's going to tell you a little bit more about that now.
Yes, exactly. Perfect. Yeah. So yeah, as Jana was mentioning, this internship was really introducing me to the field of climate change and mental health. And I, very much developed an interest for it, passion for it, and I've worked with it in many different ways. One of which was my thesis. And I chose to focus on the mental health impacts of climate change on young adults in the Faroe Islands. So the reason I chose the Faroe Islands was that often the Arctic region is a bit forgotten or neglected in research. And it's a quite interesting example because they are so remotely located. So they're quite separate from the rest of Europe. And they're very much dependent on natural resources. So about 95% of their exports are fishery. So the economy is very much reliant on fish. And what I wanted to explore was then how young adults experience mental health, how they like their risk perception of climate change and the emotional health impacts that has on them. So these are just my specific objectives. We don't have to go through them in detail, but basically I was looking at the concept of risk perception of psychological distance, and also looking at a variety of social and environmental factors and how those were impacting their experience of climate change and leading to climate emotions. Yes. So I used different concepts for this. So as I was mentioning, the socio-ecological model, and within that, the concept of risk perception and psychological distance. So these are quite interesting or important when it comes to climate change, because it is quite a complex issue and it's a bit untangible. So we were mentioning earlier that individuals who are not directly impacted yet, so who might have quite a large spatial distance to climate change, can still experience negative climate emotions because they, through media or through personal contacts, still see how the climate change is impacting the world globally, as well as then fears of how they will be personally impacted in the more distant future. And especially young adults are experiencing poor mental health because of it, because they know that they are going to be very severely impacted in the future because they have still the majority of their lives in front of them. Simultaneously, they don't often have a lot of decision-making power, political power, so they can't really contribute to the decisions that are made now on the political basis that would then very much impact their future. So there's often quite a lot of frustration because too many young adults, it feels like there's a lot of political inaction. So these were all different subjects I wanted to explore, to see to what extent climate emotions are experienced by young adults. So I did kind of two sets of interviews. So first I did contextual interviews with actually experts on either climate change or mental health on the Faroe Islands. So here I talked to their local mental health organizations as well as their youth mental health organization. I talked to the Ministry of Environment as well as a local climate NGO. So the reason I talked to them was to more get a background and understanding of the local context, to see how the Faroe Islands are actually impacted by climate change and how climate risks as well as mental health needs are currently addressed and some of the gaps that exist. So some of the reason was that there just isn't a lot of research on the Faroe Islands, so I couldn't get this information or knowledge from doing a literature review, or the few articles and reports that exist are all in Faroese, which I unfortunately don't speak. But luckily, because it belongs to Denmark, most people are very good at speaking Danish and English, so I was still able to do all the interviews myself. And yeah, language was luckily not really a problem. And then the second set of interviews, like even more important, were with the young adults themselves. So I did semi-structured interviews with young adults aged between 18 and 26. Well, it would have been interesting to also look at children or like teenagers. This was a bit more difficult in terms of like ethical approval, and also with the language barrier. That would have been a bit more difficult. So in the end, I talked to 11 young adults, 9 female and 2 male. Of course, it would have been really great to talk to more young adults, but because of the time limit of my thesis, I was not able to spend too much time on the Faroe Islands doing the interviews. And the crew recruitment process also proved to be a little bit challenging, partially because it's a subject that's maybe not very popular to an extent. So both climate change and mental health can be quite sensitive subjects. And what I also saw throughout my interviews was that, especially in the Faroe Islands, it's quite a controversial subject. And I'm going to talk about this a bit more later on. So there's definitely a bias there, that I was only talking to young adults that already had an existing interest in the field. But of course, that's reflected in my results and the limitations. Yes, so just quickly, you don't have to read it all, but just my thematic network, the different themes that kind of came up throughout the interviews by integrating the 2 different interview sets. I used thematic network analysis, and what was quite clear was that there was a bit of a contradiction between climate change being both a distant and an immediate threat. So they associated climate change both with the global implications, but were also very much concerned about the future local impacts, especially to the fishery, because as I was mentioning earlier, they are very dependent on fishery. And if the Gulf Stream shifts, this might have quite severe impacts on the Faroe Islands and their economy, which the young adults felt was not necessarily addressed currently by their government. Here was again interesting to compare the insights from the young adults to what I heard from the different authorities and the NGOs, because there's actually already a lot of work being done, but it's not necessarily communicated that well to young adults or the public in general. But yes, there are a variety of different findings that came up from it, which then led to me creating an updated version, or like redoing some of the socio-ecological model, which had been adopted by a previous researcher, adapting it to the climate emotion context. And some of the additions I had here was to look at the importance of knowledge, so both of cause, implication, and impacts and responses, and how that is very much impacted both by one's community, one's family and friends. In the context of the Faroe Islands, this was quite interesting because it is such a small location. They also in total have a population of 50,000, but a lot of them live in very small villages, with only like around 100 people. So there's a quite strong community network with a lot of values and norms being attached to it, which are impacting how young adults feel they can talk about climate change and how they can talk about mental health. It's still a quite conservative context where there's a lot of stigma around mental health, especially in the older generations. So it's interestingly quite different to the Danish context, which is partly can be explained by their remote location. Yes, I don't think we have time to go through all of it in detail.
4 minutes.
4 minutes. Perfect. Yes, but my point being that it was a quite interesting to integrate the aspect of psychological distance and risk perception into this model, looking at the temporal and hypothetical distance, the spatial distance, and the social distance, and how all of these combinedly are very much impacting how young adults perceive climate change. One of the key findings, I would say, from my thesis is that a lot of it comes back to communication. This was quite an interesting finding in terms of talking to the authorities, and that's so both the NGOs and the governmental authorities and the young adults, because a lot of the statements were quite contradictory. And while the Ministry of Environment might already feel like they're doing a lot of work in addressing climate change and a lot of work in engaging young adults as well in those processes, this was not necessarily communicated to the young adults, or at least that was not the perception that was shared throughout the interviews. Media also playing a very important role in terms of how climate change is framed, because one of the key young adults felt like there was nothing really giving them hope. So there was a lot of feelings of overwhelmedness, of fear, of frustration. A lot of them were telling me that they felt like it was too late to address climate change, that they were very afraid of their future and can't even imagine what the world is going to look like in a few years. And this overwhelming feeling that those who are at the moment in power positions, politically or economically, are not necessarily taking the necessary steps to kind of protect their future. So luckily, there was a very strong interest by the different authorities who I interviewed to see the findings of the report as well. So I'll have a conversation with them at a later point, talking about some of these findings, and hopefully that can lead to some improved communication about some of these challenges. But yeah,
impact research you're doing.
Yes. Yeah, so that was just a short introduction. Obviously, we have time for questions later. But do we want to talk a bit about next steps, or how?
Yeah, just really briefly before, I'll be 1 minute, Sarah, because I know what you're like for timing, but I just want to mention before we go to questions, just a couple of kind of things that have come out of both, particularly the project we did at the PS Centre. So one, and this was also aligned with the Nordic Network conference that happened earlier in the year, where there was a track on climate change, but the PS Centre and the MHPSS collaborative that's also here in Copenhagen are currently planning participatory sessions on climate and mental health that will look to develop a kind of framework to help us understand and place existing MHPSS work in kind of the context of climate change. Because a lot of what we heard was, how do our existing programs and approaches and interventions fit in the context of climate change? So that is, hopefully, please keep an ear out for that, because we're really looking for people to participate in that. That'll be like October time. And then also, there's a great researcher from McGill University called Yura, I can never pronounce her last name. Thank you. Yeah. Okay. She's excellent. And she and I are designing a research project at the moment to look more into the work of national societies on climate change and MHPSS, and really also start to look at how we can embed some well-being indicators across not just MHPSS work, but work that might be working to address impacts of the climate crisis, to start to understand this kind of multi-pronged approach, right, where you can have well-being outcomes from non-MHPSS related work. So we will also hopefully come to you as the research network to be involved in that, but there is some work happening. And that was, sorry, Sarah, 2 minutes.
Thank you both. Thank you, Finia and Shonya. Really, there's obviously so much to speak about, so much to share. If I could thank everyone for listening so attentively, and invite anyone who would like to ask a question to come off mute, perhaps put your camera on and ask Finia, Shona, and indeed anyone present, any questions that you have, any comments, any reflections about the pieces of research that you've heard, or if you have plans around research or activities linked to mental health and climate change, would be really interested to hear them here. And if you're feeling shy or not confident about your audio or camera, then feel free to put any questions, comments or reflections in the chat. We'd be really pleased to engage with you. I'm just really struck by how highly interacting different elements are in cause and effect, Finia and Shona, and the different stakeholders that you've really kind of, highlighted for us. And I think that the observation around communication is so key, and something that I think all of us are involved in some form or another. I don't know if you wanted to say more about plans to follow up or thoughts around communication. But also the other one that struck me as you were talking, you mentioned about power, is the social inequalities. Because people who have less power are more impacted. So yeah, any reflections? And I also, yeah, over to you.
I will I think we just got locked in here, sorry. I will speak just briefly to the communication piece, because it certainly also came out of the consultation that we did, right? So where national societies were saying, yeah, it will be 10 minutes, 12 minutes. National societies were saying, we don't know how to talk about this, right? So I think, and that's a similar issue, I think, that Finya found in her research, because it's about communication between stakeholders, I suppose, that are working in this space, but also it's an issue for researchers. And, you know, if we're talking about research now, it's about how we communicate findings so that practitioners can use them, so that communities who are affected by climate change can understand that there is work happening, or that can also understand how to leverage the outcomes of research for community action, for example, or to challenge power, right? So I think it's a super interesting finding from Finya's work, but also really interesting that it was also a theme from a completely different cohort of people, right? People who are working in this space saying, we don't know how to talk about this, and we know it's a problem, but we don't know how to put it into words. So it's a sort of a science communication issue, which is not, I think, unique to the MHPSS space in climate change. It's a broader issue when we talk about climate. But do you want to?
Yeah, no, I was just going to say that, yeah, a problem was there, again, that because there was a bit of a lack of communication to an extent from maybe the public authorities or researchers, or kind of from the science side, that the young adults specifically felt like most of their knowledge was coming from social media. So often it was quite fear-based media, with very extreme images, which were causing them to feel very much afraid and worried about the future. But most of this kind of source of information, or like kind of information, was not coming with any solutions. So nothing that was really giving them any hope. So there was very much a need of, yes, being informed about the reality of climate change, of course, but that also being then combined with some of the progress, as well as some of the steps that are taken by people in power, and what can be done by the individual, without putting all the responsibility on the individual, but looking at more of the community work and what you can do by, for example, voting, and by connecting to different organizations that are already doing some of this work in your environment. But yes, that it often seems like such an untangible, huge, complex problem that it feels like it can't be addressed either way, especially with this very kind of severe fear-based media, and that we need to sometimes break it a bit more down to look at, but we can actually have an impact as a small community, even if it's the Faroe Islands, or it's, even so.
And I think to kind of in a way bring it back to kind of research, being at the research network, is, and something that Jura and I have talked a lot about, which is we have these we have some understanding within MHPSS world that there are actions that we can take that help us feel better, you know, in some ways, and some of those are very well evidenced, and some are less so. And I think an issue we have as it relates to the climate crisis is there is some research to suggest that being involved in activity and action is protective or good for our well-being. So, you know, if you feel distress and despair about climate, being involved in climate action might be good to kind of counteract some of that hopelessness, right? But it's difficult to study, and it's difficult to kind of be able to say, we can't say in kind of with any great confidence that A equals B, you know, that's not going to work. So it's why Jura and I are interested in looking at how we can work with national societies to design easy to monitor indicators potentially that we could start to embed in the work of national societies that maybe are not straight MHPSS programs. So this is very much in the space of like integration, right, of MHPSS, so that we could, perhaps the thing that a national society does is their MHPSS focal points say to their other departments, we just want you to start monitoring this. We don't actually want to do anything. All we want you to do is start asking people X question to see if we can start to build the connection between some of these projects that might not necessarily have an MHPSS at its heart, but it is actually building social connection. It's helping people take action around climate change. It's reducing, say, financial insecurity or food insecurity. And so, because I think the report that we prepared, so many of the drivers of climate change, or so many of the things that climate change impact, the mental health and well-being aspect is kind of downstream a lot, right? And so it's really difficult for us to say X will have an impact on your mental health and well-being, because I mean, even if we talk about extreme weather events, there's so many different things. So I think many of you know I co-chair Working Group 1 for the roadmap with Sarah, which is on integration of MHPSS. And I think for climate, we're very much in that space of how we integrate MHPSS into a range of different programs to address some of these impacts that will be driven by changes in climate or more extreme weather events. And maybe one of the unique parts of climate impacts will be some of the work around climate emotions, around ambiguous anticipated losses. This is kind of more unique. I mean, this is something we don't currently do, whereas the other things we work in already. We work a lot in health, we work a lot with disasters, so we do stuff there. But with this sort of vicarious or anticipated, we need to be careful that we're not just focusing on high income settings, because actually there is a lot of that experience also with people who are far more vulnerable to the impacts of the extreme impacts of climate change. So, and a lot of, as Finia pointed out, a lot of the existing research around anticipated and vicarious exposures are from high income contexts. So from a research perspective, we really need to see more research from lower resource contexts. And also something we haven't mentioned, but also in terms of anticipated losses, relationships with land, with community, power and trust are issues when we're talking about Indigenous cultures who will be dispossessed from their lands again. So just also goes to show the complexity of this topic. So
yeah, and in line with that often the research is that is more on the direct exposure of like extreme weather events, for example, is very much focused on climate change as a one-time event rather than looking at it over a long period of time, because often it's kind of disasters that have a cyclical nature that are reoccurring again and again, or it's this long process of knowing that the sea level is rising and having like island communities that know already in 10, 20, 30 years, this is going to have quite a severe impact on us. So it needs to also be studied over a longer period of time. The same with like young adults in maybe more high income contexts, that this is something that they're just exposed to over a very long period of time. So it can't just be viewed as like this one-time event. But yeah.
I think the moral of the story is, if you're interested in talking about this, Finia and I am more than happy to discuss with you. I will put my email in the chat for you, Sarah. And I think, how do I get that? I'm sorry, I can't drive.
And while Shona's doing that, I think Monia is also just going to put in the chat again the Psychosocial Reference Centre's web pages, where you can find out much more detail about both reports that Shona and Finia were talking about. So you can, there's also reports on that page from the World Health Organization. So lots of resources. We really encourage you to go and check out those resources. I know people are leaving now for their next meetings, but just really wanted to thank Finia and Shona for presenting such a complex and important subject in such a thoughtful and considerate manner, really helpful, really clear, really thought inspiring, and really hope that as many people will contact you, Shona, with regard to future collaborations. That's what we're part of, this research network, making not just researchers but practitioners more in touch. Thank you each. Have good rest of your days, evenings, and look forward to seeing you at one of the next network webinars. I put those in the chat. We'll obviously be emailing as well. Really good to see you. Thank you so much for being present. Take care.
Bye.
I can just stay and ask us anything. Yeah, don't know.
Thank you so much. Bye-bye.
Bye, Amanda. Nice to see you.
Bye all.
Shamila, so sweet. It's just saying, Monia, it makes me happy that I have pushed the comms team to have everything on one page for climate, because I knew that it would come in handy at some point. So it's good to have had my my assumption.
I really love those focus areas. This is so helpful to have
Oh, isn't
everything
it
together.
just?
Yeah, no, definitely.
So there is, I think, I'm Sarah, Kate and I were talking about one on M&E. So I think, yeah, that will be something that I will do at some point also. But yeah, we had a draft. So yeah. Thank you very much, ladies. Thanks for having us.
Thank you. Thank you so much. Really, really useful. Really good. Really, really good. Thank you. Do you want to stop recording? And
yeah, I was, oh, thanks. I don't know why I keep taking over and driving, because you're, yeah.